Welcome everybody to today's webinar. We're going to look at feeding the performance horse for different disciplines, but we're also going to focus on um, joint health at the end as well. So we'll look at basic nutrition, different types of performance, because someone might say, you know, I'm doing dressage or light exercise, or I'm doing heavy exercise. So horses, right? We know free ranging, they've eat, evolved to eat a wide variety of different forages, nibbling continually. They usually eat for about 17 hours out of the day, and they move while they eat. They don't eat in the same place. Why I talk to people about this at the very beginning of every presentation is because that is what horses are designed to do. This is the jumping off point. We have to, if this is what they're designed to do, we need to try and mimic that. Many of the nutritional disorders we see in horses are because we change their diet and we change their behavior and their eating behavior. They fit into our schedule. And saying these things it's not our fault. It's just a fact, right? They have to fit into our schedule, the convenience, what we have available to us, what we can afford, what we think they should eat. They're at the mercy of all of that. So we need to know the basics of the digestive system, and we'll briefly go through this because I know we've gone over and over and over it. But again, the stomach is small in relation to the rest of the digestive system. It's one small compartment. There's acid in the stomach, acid in the bottom part of the stomach that starts breakdown of foods, proteins. Um, the stomach is very small, though, in relation to the rest of the digestive system. So we don't want to feed large meals to horses. Let's see if I can move this. And because of the way the acid is continually secreted, gastric ulcers are a big problem in performance horses. So more than 90% of racehorses have gastric ulcers. You know, more than 60% of performance horses have gastric ulcers. It's pretty rare for horses in pasture to have chronic gastric ulcers. The small intestine, it's about 70 feet in length. This is where we don't have acid or bacteria. We've got enzymes here that are continuing to break down and digest that food, your carbohydrates, your sugars and starches primarily, your non-structural carbohydrates, protein, fat, vitamins, and minerals are all digested and absorbed here. The large intestine, largest capacity of the whole digestive system. The primary thing that's meant to be fed and digested in this part of the digestive system is fiber, right? Forage. It's really large to promote that fermentation. And there's all different kinds of microbes, but their primary goal is to ferment plant fiber. This is what we collectively call the microbiome. And the microbiome, those microbes, when they digest and break down that food, they create volatile fatty acids. That in turn gets turned into energy, B vitamins, vitamin K. These are things that are synthesized by or made by the bugs that live in the hindgut. When we talk about B vitamins and vitamin K, they are what we call non-essential. It doesn't mean that the horse doesn't need them. It means that the horse can make them and they don't need to be fed in high quantities in the diet, right? So if we keep the gut microbiome healthy, it will make B vitamins and vitamin K. Unlike something like omega-3 or omega-6 fatty acids, they cannot be created in the body. They must be consumed in the diet. They are considered essential. Absorption in the large intestine. We've got water, our electrolytes, your sodium chloride, potassium, phosphorus, all absorbed in the large colon. So, overview, real quick, simple stomach, large sacculated hindgut meant to digest fiber. The horse was designed to graze. Fiber is critical to optimal health, right? From the get-go. And anything we can add to the diet that is going to improve their ability to digest fiber and gut health. So feeding the performance horse, we've got all kinds of different performance. The basis of all movement is muscle contraction, right? The ability to do work. You've got bones. What holds bones together is ligaments. And then what forces contraction is muscles. And muscles are held to the bone with tendons. Okay? Ligaments hold bones together, tendons hold muscle onto the bone so that when the muscle contracts, the bones can move. Right? That's the basis to movement. Energy is a nutritional factor of primary importance when feeding the performance horse. It's also the reason why we have different feeding rates. So you buy brand X commercial feed, and the feeding rate, it says, is 3 pounds a day. But you could go to another brand and buy their bag of feed, and it might say the feeding rate's 8 pounds a day. The reason why we have different feeding rates is you will find that the higher the amount of energy that is required, the higher the feeding rate, right? If you look at a ration balancer, for example, it's a really small quantity that you're feeding, 1 pound a day. It's got no energy. If you look at the DAX vitamins and minerals, they are vitamins and minerals. They're not going to provide energy to the horse. And that's why we can feed them in such small quantities, because energy isn't very dense. And so we need to be able to feed the horse a large quantity. Sources of essential nutrients. So water, forage, hay or pasture, grains, concentrates, and supplements. Absolute minimum is we start with forage, right? Water, of course, your horse can't live without water, but forage. Bare minimum is 1% of their body weight. It's absolute minimum. I don't recommend anyone do that. Your horse will lose weight, not do great. When I have a horse on a weight loss program, I put them at 1.2% of their current body weight, and that'll be about 1.5% of their ideal body weight, unless they're extremely overweight. Most of our horses, though, are going to eat between 1.5 to 2.5% of their body weight. Now, your upper level, higher performance horses that are doing, like a racehorse, for example, that's doing a lot of exercise at speed, usually we say we have about an 80-20 forage to grain ratio, right? 80% forage, 20% grain. As you get up into those doing significantly intense exercise, polo ponies, racehorses, you might see that shift to 70-30, 70% forage, 30% grain, because we've got to get more calories into them, more energy into them. So we by nature have to feed more grain. We also look at feeding more dense energy sources. But this is for a whole nother webinar. Energy isn't just energy. Calories aren't all the same, right? Energy gotten from digesting sugars and starches is what we call quick release energy, right? It's going to fuel those fast twitch muscle fibers that are going to turn over really quickly. Energy from the digestion of fat and fiber is going to give you that slow release energy. That's going to give you a lot more long, slow stamina, right? There are horses that do both types of exercise, and they need both types of energy. Now, obviously, we feed forage for a whole slew of other reasons, not just its energy component. But a forage-only diet. Now, I know these have become quite popular, but depending on what the horse is doing and how much energy it's expending, it may not be, the forage they're feeding may not be able to provide enough calories to even maintain their body weight, let alone maintain that and extra level of performance. Doing exercise at speed, we're not getting a lot of that fast twitch type energy, like the sugar and starch type energy from a forage only diet. So that would be a challenge to feed a racehorse a forage only diet. And if you're just feeding forage and you're not adding a vitamin and mineral supplement, we know at least these three nutrients are going to be deficient: zinc, copper, and selenium. Right? Selenium is a powerful antioxidant. We know that horses doing exercise are constantly going through oxidative stress, and antioxidant combats that. Things like muscle soreness, inflammation, these are all signs of oxidative stress. So we need those antioxidants like selenium and vitamin E to help with that. Zinc and copper, zinc for immune function, copper for joint health. Depending on the quality of the forage, whether they're going to get enough protein. So forage only diet is never just forage only, right? There's got to be supplemental sources of nutrients when fed with forage. So then we look at something like for a performance horse, the Total Performance Plus, or the orange, right? Not providing a lot of calories, but it is going to, with a good quality hay that's providing the protein, because remember that the DAC orange and the Total Performance aren't providing enough protein either. They're a vitamin and mineral supplement, but this is going to be for, if you were just doing forage, the vitamin and mineral, and maybe a squirt of oil to stick it all together, that's going to be for your lower level performance, not a lot of that quick release energy. But this is going to balance the copper, zinc, and selenium in the diet and many others. But if we're looking at exercise like this, intense jumping, galloping, the amount of calories or cereal grains, depends on the intensity, depends on the body condition. If the horse is thin, moderate, or overweight. And it depends on the calorie density of the feed. If it's not very calorie dense, you have to feed a lot of it. It's like a senior feed, for example, is not very calorie dense, because we know a true senior feed is replacing the hay portion of the diet, right? So if the horse needs to eat a minimum 1.2 to 1.5% of his body weight, we're looking at 12 to 15 pounds of fiber. So we're looking at 12 to 15 pounds of senior feed. So we've really, as nutritionists formulating those feeds, diluted out the energy over a very wide feeding range. And so when people feed senior feed to a performance horse at 3 to 4 pounds a day, you're really shortchanging them on so many nutrients, including energy. So we look at body condition score. This is really important because body weight can help us. Okay, we need to feed 1 scoop, 3 scoops, 2 scoops of a vitamin and mineral supplement. But body condition is going to tell us we need significantly more calories. We need less calories, right? 1 or 2, these horses are emaciated, way too thin. You can see all the bones. You don't even have to touch the horse to say this horse is thin. And 8, well, you don't really have to touch the horse to say this horse is too fat, too. We've got a crest. You don't really see the wither. You can't quite see where the tail head is. Where you do up the girth, it's probably got a fat pad. 5, this is ideal, right? And unfortunately, there's actually been quite a few survey type research studies looking at kind of public perception on what is ideal body weight. And unfortunately, a lot of people, especially in the hunter ring, whether it be English or Western, that is what they say is ideal. And that is overweight and is dangerous as far as metabolic conditions. This horse, a 5 or a 6, is more ideal. But unfortunately, a lot of judges and competitors would say, oh, that horse is too thin. Amount of grain, individual horse differences. Again, okay. So depending on the exercise level or the level of competition, moderate exercise, medium intake, anywhere from 3 to 8 pounds of grain concentrate that's going to give them the energy they need. And then adding something like the DAC oil is going to help with extra calories because these horses need stamina as well. And it's also going to help with hair coat, make them look real shiny and slick. You've got 3-day eventers or jumpers, polo ponies, higher intake, right? The feeding rate is probably going to be 6 to 12 pounds of grain to get the amount of calories into them. Depending on the horse, as to whether they need a low sugar or a higher sugar, high fiber, high fat for these horses because they're doing exercise over 3 days. DAC oil, the bloom is going to help with extra protein, and then probiotic paste, DDA, rescue aid for gut health because we know these horses are stressed. We know that feeding grain actually isn't that safe for horses. We know that undigested grain that's not digested in the small intestine will spill into the large intestine, where bacteria will ferment that grain, produce lactic acid, and cause a whole slew of problems like this that you don't want to see: digestive upset, colic, poor nutrient utilization, bacterial infection, disease, diarrhea, compromised immunity because that microbiome, leaky gut, fecal water syndrome, all these things when the microbiome gets upset when we're feeding large quantities of grain or in a single meal or just large quantities of grain for maintaining body condition or exercise level. So feeding grain, it's not natural to the horse, but we also know we need to do it. So understanding the pitfalls means we can go in there and mediate some of those. So we want to stabilize those good bacteria, guard against pathogenic bacteria, maintain normal gut function, protect the immune system. So by boosting and protecting that microbiome, 70% of the immune system starts in the gut. So we're helping the immune system there. Our things like the DDA, the rescue aid, pre and probiotics, and also the GI Pro 3, right? Remember, we've talked about how the GI Pro 3 actually will communicate, it will interfere with the communication between pathogenic or bad bacteria so that they cannot take a hold. So they are a must. Either the DDA or the rescue aid is a must in every performance horse's diet. We don't want that hindgut to get unbalanced and then those lactic acid producing bacteria proliferate too much. It lowers the overall pH. It turns into a vicious cycle because then they're killing other microbes. Toxins from dead bacteria cause colic, laminitis. This is not a good thing. So another ingredient, the YSAC, that is in the DDA is, find my books, I think it's in a couple of others. When we look at the cecum and the colon, so the cecum is the first part of the large intestine and then the colon is the next part. And if we look at adding the YSAC, it can really stabilize that hindgut acidity when large quantities of grain are fed. So again, the DDA and the rescue aid are a must, one or the other, in a performance horse diet. We're stabilizing, we're improving those bacteria that are breaking down fiber. We're increasing the amount of those lactic acid utilizing bacteria, decreasing the ones that create acid, decreasing the acidity, stabilizing the pH. This overall improves the feed efficiency, fewer digestive disorders. Oops, it's not formula, it's an old slide. We also know that lameness is one of the big problems that stops performance. You got a lame horse, you can't ride it anymore, right? That just puts the kibosh. You may have a horse that's got a little bit of diarrhea. You keep riding it and you can manage it. But if your horse is lame, you cannot ride it, right? Lameness is often associated with the joint. So let's look at the joints. Joints are defined as a structure which joins two or more bones to form a single anatomic entity. Okay, we'll have a look at the major joints in a minute. Types of joints. We've got fibrous joints. Okay, so if you think about in a skull, there's no like flexible joint between the plates in your head. There's fibers that hold those two plates together. That's a fibrous joint. Cartilaginous joints, okay, joins the ribs to the sternum. And then we've got synovial joints. That's what these joints are movable, right? Most of our limb joints are synovial joints. These are the joints that move. So we think about a person and your shoulder joint is that joint kind of like the point of the horse's chest. The elbow is right where you do up your girth, cinch up your girth. The wrist is actually the knee joint. And then your knuckles is the fetlock. And all the way down into where the coffin bone joins on, that's like the end of your finger. If we look at the back leg, the hip, you know where the point of your horse's hip is. The stifle is actually the horse's knee. The hock is your ankle. And then your that last joint in your middle toe is the horse's, where the coffin bone joins onto the fetlock. So, joint components. We've got this external supportive structure that's outside, the joint capsule. You can see it here, this light pink tissue joint capsule. Inside that, we've got synovial fluid, which is this brown in here. The synovial capsule or membrane that's holding all that synovial fluid in there. Then we've got articular cartilage. It's on the ends of these bones. And then the bone right underneath that is subchondral bone, right? This synovial membrane is really important because it holds that synovial fluid in there. If the synovial membrane gets inflamed and deteriorates, the synovial fluid leaks out. And if it leaks out, then the joint is not lubricated, and then we'll start to get bone, that cartilage on pressing on the cartilage, and it'll wear away, and then we'll have bone on bone. So that synovial membrane, because there's actually no blood vessels in the cartilage, but the synovial membrane lies in very close contact with blood vessels in the joint capsule, filters plasma from the blood vessels to form synovial fluid, and synthesizes hyaluronic acid. Okay? Hyaluronic acid is the predominant ingredient in the joint fluid. So we've got the articular cartilage. We've zoomed in here. Is that white? The synovial fluid is the yellow in the joint cavity. And then we've got this synoviocyte, or this is the lining. This is that joint capsule here. And then blood vessels on the outside, and then tissue outside of that. There's no blood vessels in the synovial fluid or the articular cartilage. Hyaluronic acid, it's very important, right? Acts as a barrier. It lubricates the joint capsule. Articular cartilage is also really important. It's that glistening white substance that covers the end of the joint. And it allows, it actually, when pressure goes on that articular cartilage, it disperses that pressure and spreads it out so that you don't just have banging on one location. But if the articular cartilage breaks down, that is the limiting factor. So we need to keep that healthy. So there's actually a lot of water in the articular cartilage. The cartilage contains no blood vessels and no nerves, no sensory nerves. But we've got that subchondral bone down here. We've got a layer of calcified cartilage And then we've got water cells, these collagen fibers that kind of act like springs in there. Chondrocytes will allow it to turn over. That's what turns it over. When force is placed on the cartilage, water pushes out of these kind of collagen bottle brush configurations. And as the force is removed, the water sucks back in and it resumes its shape. You can see here. See, it squeezes in and it lets go. It doesn't take all of the shock itself. It spreads the shock out, and the shock is absorbed into the subchondral bone, right? So we need to make sure that that bone, and you can see we have more kind of honeycomb type bone here. If you've ever cut open a cow bone or a chicken bone, or got one of those dog chewed bones, and you can, if it's cut in half, you can see that kind of holy bone, and then you've got solid dense bone, and then that calcified cartilage, and then you've got articular cartilage on the top of that. But the cartilage, it's like a vest that a motorcycle or a 3D event rider would wear, and that foam is like the cartilage, and it it doesn't absorb the shock, it just spreads it out, so there's not a whole huge amount of shock going in one space, right? It spreads it out. So joint disease is accompanied by increased joint pain, whether it's limb dysfunction that causes decreased exercise, muscle atrophy, the muscles are breaking down because they're not able to work that, ligament stretching, cartilage damage, inflammation, synovitis, itis, inflammation of the synovial capsule, increased abnormal joint fluid. So joint fluid is meant to be nice and thick and viscous. It's not meant to have blood in it, and it's not meant to be thin. And also, if you have that joint capsule is stretched or scarred, then it's weaker and it's not holding all of that fluid in there. So inflammation, what is inflammation? It's the process by which the body identifies, isolates, destroys, and removes an inflammagen, microbe, a damaged tissue, or a foreign substance. Like, the ability to have an inflammatory response is critical to life, right? You need to be able to get rid of what they call inflammagens, pathogenic bacteria, damaged tissue, foreign substance, like a bee sting, right? It's a normal body function with leads to the repair and wound healing. If you don't have an inflammatory response, you're never going to be able to repair or heal a wound, right? It is critical. But we also know that inflammation can get out of control if the stimulus is strong enough and we don't nip it in the bud. And unfortunately, horses that are overweight and then exercise and then stuck in stalls, there's so many things that cause inflammation in the body. So we have chronic whole body inflammation. When we have an injury to the joint, it's mostly that synovial membrane, right, that gets damaged. We have inflammation then. The blood vessels are sending white blood cells, they're sending nutrients to that damaged tissue. And then unfortunately, when that synovial capsule is damaged, it's permeable. So it allows synovial fluid to escape, or it allows blood to flow into the synovial fluid. So now it isn't as viscous and it's thin. The other thing is white blood cells. White blood cells come when you have any kind of trauma, and they're going to enter the synovial fluid trying to repair that damaged tissue, and they in themselves cause damage. They break down the hyaluronic acid, therefore there's no more lubrication. These inflamed synovial cells also begin to produce other enzymes that continue that breakdown. And now we see the degradation of that articular cartilage. So this is the bloodstream out here, and we've got those white blood cells going through that permeable synovial capsule into that joint fluid. Now they're causing damage to that articular cartilage, so we don't want that to occur. This is a series of slides that I thought were quite interesting. You can see if this was a healthy horse, this would be a nice, clean pink with no cracks. But osteoarthritis, this is at early stages, and we just start to see some breakdown, some cracks in that articular cartilage. And then those cracks can actually form valleys or bigger gaps. And now we've got exposed bone. And the synovial fluid leaks into those cracks, causing further damage. And sometimes they can cause a cyst in there. Sometimes that articular cartilage will actually snap off and float around in that joint. They have to be removed surgically. These bone chips need to be removed surgically. When all of that cartilage is gone, that's permanent. At that point, there's not a supplement or a drug that is going to make that cartilage regrow. So we need to make sure that we are decreasing the stress on those joints and managing those horses correctly prior to that occurring. Other supportive technologies or managements. Cold for acute inflammation. So if you just have immediate inflammation that pops up, we want cold therapy. Heat if you have chronic inflammation, because that's going to increase blood flow. Wraps, liniments, braces, poultices. I know we have a poultice, liniment. These are all going to decrease that inflammation. The key nutrients in that synovial fluid were hyaluronic acid, but chondroitin and glucosamine make up healthy cartilage tissue and keep supporting that cartilage tissue. So the Optimum Flex Plus, which I think is on sale this month, contains all of those. So with a performance horse, start with good quality hay. Adjust the grain to maintain the body condition. Use vitamin and mineral supplements to support their mineral requirements. Use digestive supplements to support their hindgut health. Use the joint supplements to support those joints. I always say that liquid HA when they're young, because we know we've got a lot of just inflammatory stress as the horse gets older and we've got osteoarthritis developed, then we want to use something like the Optimum Flex Plus. The Herbal Respond can also, and the Yucca, help with mitigating inflammation. Now, the Herbal Respond, some people say, oh, it's a bute alternative, and you don't want to use bute long term because it can wear away at that kind of mucus coating in the bottom of the stomach and cause gastric ulcers. The herbal respond will actually do the same thing. So it's not really a butte alternative, but how you get around that is when you feed the herbal respond, you feed it with a little pre-buff or a little alfalfa, or you make sure that you're doing cool gut with it. So there's certainly options when you're using that. Any questions?